If you're considering testosterone replacement therapy and want to increase your chances of success while minimizing potential risks, here are some important tips to keep in mind. Consult and choose qualified healthcare clinic. Seek guidance from a knowledgeable healthcare provider with experience in TRT. They can assess your specific needs, monitor your progress, and make necessary adjustments to your treatment plan. Undergo thorough evaluation. Before starting TRT, your healthcare provider should conduct a comprehensive evaluation, including blood tests to determine your testosterone levels and assess your overall health. Choose the right treatment method. Discuss the various TRT options with your healthcare provider, including injections, gels, patches, and implants. Select the method that aligns with your preferences, lifestyle, and health considerations. Compliance is key. Adhere to your treatment plan as prescribed. Missing doses or inconsistent usage can affect the success of TRT. Regular monitoring. Regularly check in with your healthcare provider to monitor your progress and address any concerns or side effects promptly. Adjustments to your treatment plan may be necessary. Healthy lifestyle. Incorporate a healthy lifestyle into your TRT plan. This includes maintaining a balanced diet, engaging in regular physical activity, and getting enough sleep. A healthy lifestyle can complement the benefits of TRT. Manage stress. Stress can negatively impact your hormone balance. Incorporate stress management techniques such as mindfulness, meditation, or yoga into your routine. Avoid alcohol and excessive caffeine. Both alcohol and excessive caffeine consumption can affect testosterone levels and may counteract the benefits of TRT. Quit smoking. If you smoke, consider quitting. Smoking can have a detrimental impact on hormone balance and overall health. Follow a heart-healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can help support heart health. This is important because some potential risks of TRT are related to cardiovascular health. Be patient. TRT may take time to show its full effects. It's not a quick fix, so be patient and allow your body to adjust and respond to treatment. Regular health checkups. In addition to monitoring your TRT, maintain regular health checkups to address any potential health concerns that may arise. Communication. Openly communicate with your healthcare provider about any concerns, side effects, or changes you experience during TRT. Remember that individual responses to TRT can vary, and it's essential to have a personalized approach based on your specific health needs. Follow your healthcare provider's guidance, maintain a healthy lifestyle, and stay committed to your treatment plan to increase the likelihood of a successful TRT experience. Until next time.